guest of honor, ladies and gentlemen, who hails from a country that's actually a forerunner in digitization. Ladies and gentlemen, he hails from Estonia. Well, he's a global health advocate whose mission in life is to foster health as well as happiness. How beautiful is that? Well, in the words of Professor Gupta, if I would like to quote, well, without him, we literally couldn't have envisioned this summit. Ladies and gentlemen, I want all of you to please bring up some good applauses to welcome the advisor for e-Services Innovation, Ministry of Social Affairs, Government of Estonia. Please welcome Dr. Prit Towell.
Hello, everyone. Just quickly adjust this. Right, so today I'm going to tell you a bit about e-health in Estonia, what we have achieved, what we've learned. When I asked my colleagues what I should talk to you about today, first thing they mentioned is that I should talk about what is Estonia to begin with. So as you heard, Estonia is a country. Indeed, if you compare it to India, we would be roughly 6 times smaller than the Maharashtra state. But in terms of population, we would actually be 100 times smaller with only 1.3 million people. Indeed, when it comes to population, we rank 153rd in the world. But when it comes to matters like digital health or digital life, we tend to rank first or second. Thank you. And the reason why we've invested so much into something like digital health and digital living is because of the comfort that this brings and because of the efficiency that this brings. We like to say that in Estonia, you can do 99% of your business online except for getting married, getting divorced, and selling real estate. And this is very much true, and we are working on those final 3 use cases. And the reason is because it's just so much more logical to do all of this online than to spend your time queuing at a government office and using up valuable personal hours to do all this thing. But now to talk a bit about how we did it. And I think this can be summed up in 3 key things. It's people, it's the principles, and finally it is the technology. Now, people come first, so this is not a random order. Many people have marveled over the fact that we have managed to do reforms that touch upon quite sensitive issues like personal privacy, security, in terms of digital. And they say that, oh, well, Estonians are just so different, you know, they are so trusting of technology, but this does not come about at random. This was something that we've invested heavily since our re-independence in 1992. We made sure that every school has a computer class, that every student knows how to use basic digital services. And this is not just essential for creating trust for digital technology, it's also essential that if you are creating digital services that you're not leaving any people behind. So it begins with the people, and it goes all the way to everyday practice. You know, if you're rolling out a new service, you also have to roll out an educational program to make sure that everyone, for example, on a hospital level, knows how to use this. Principles are also key and come second. And there are perhaps 2 central principles to this entire Estonian e-government, which is the once-only principle, is that the government or a public body gets to ask you something only once. And after that, it should be logged within the system. We should know about it. The second thing is digital by default, is that if we're creating a new service, then digital is the default. And if you want to add a paper option, then fine, be our guest. There are also some key things like having sure that privacy is guaranteed by design. There are technologies that you can use to have privacy by design and also trust by design or transparency by design, meaning that nobody should trust this blindly, what we are doing. You should always be able to see what is happening with your digital data. And finally, which is really essential for the medical sphere, is the control of data, so that patients and people control what happens to their data, can always see what is being done with their data. And once you have these principles in place, you can start planning the technology to actually make this happen. So technology tends to come first in these discussions, but this is, I think, a misstep. You have to first figure out what is the skill level of your people, what are the principles that we want to adhere to, and then you begin building the kinds of technologies that will ensure that you have meaningful services in your country. Now, one of the key technologies that we've had is X-Road. So X-Road isn't just the backbone of eHealth, it's the backbone of the entire e-state. So anything from the business registry to the population registry to a hospital information system is connected via X-Road. And it is a relatively cheap, secure, internet-based system, which is quite flexible in that if you want to add something or remove something from X-Road, you can do that. You don't have to individually connect everyone to everyone. You just connect them to X-Road and data begins flowing. So data exchange has been such an essential piece of the technology puzzle into ensuring digital health. And when it comes to the entire e-state, we've calculated that we save 1,400 years of work annually just by having these digital queries. Nobody has to answer you about basic facts of government that you can look up online. We've also calculated that we save about 300 meters of paper every month, which is the size of the Eiffel Tower, because we don't have these paper-based queries anymore. Everything is connected via X-Road. The other key digital technology here is EID, in that you have to have a way to identify yourself online so the system knows who you are, and by doing that, what you can do. So this is very key for medical systems as well. You have to be able to differentiate between somebody who is actually a licensed doctor and who is not. You have to differentiate if somebody is your patient or not, and this starts with EID. So now every Estonian has this identification card, which allows them to access all the digital services. And we're also rolling out newer technologies like mobile ID, where this card is basically ingrained in your SIM card, or Smart ID, which is a slightly different technology as well. And the good news is that EID is not limited to Estonians. If you want to become an e-resident of Estonia and use the services of Estonia, then you can apply for an e-residency EID card as well. So do look into that. It is quite a fun concept. And talking about something like transparency by design or privacy by design, Estonia has experimented with using blockchain technology for quite a long time within e-government, including e-health. And what this adds is a very important layer of data immutability. In that if we are creating a log of something, if you make a query about someone in the e-health system, then this query is always logged. We will always be able to trace that back to you. So if you are looking up data about somebody that you should not look up data about, then we will always know. And this trace of you cannot be deleted because it's kept in thousands and thousands of blocks on a blockchain-based system. So this goes into privacy by design, and it's also transparency by design because this log is viewable to you as a patient as well. And based on this technology, we've built a number of different services. And I think instead of telling you about these, I just show you a short video which explains how these key technologies work. Right. Let's see.
Meet 3 Estonian e-citizens, Lee, Martin, and their son, Hugo. While at school, Hugo accidentally broke his arm. The treatment he received can easily be seen by his mother through the patient portal. To enter the patient portal, Lee uses her digital identity, which is tied to her unique personal identification code. This is her doorway into the national health system, where healthcare providers gather medical data related to herself, her underage children, and her grandmother, Vive, who has given her authorization. This way, Lee has an overview of everything related to Hugo's treatment, including doctor's description of the X-ray, as well as the list of prescribed medications. Estonian healthcare providers and people with authorization are allowed to access the medical data, though the patient can always revoke this right. Every query made about the patient is logged, which makes the system reliable and traceable. Now that Lee is fully informed and at peace, she can start comforting Hugo. Lee has to go to the pharmacy to buy medication for her son Hugo and her grandmother Viva. Estonia uses digital prescriptions, which means Lee only has to provide identification and her son's personal ID code. The pharmacist can access the system to see prescribed medication. After providing her grandmother's personal identification code, Lee can buy medicine for her as well. Digital prescriptions make it much easier for Lee to take care of herself and her loved ones. Last year, Martin had a traffic accident. Nothing too serious, but as a result of the collision, he hit his head that caused a small bleeding. This is usually harmless. The dispatcher of the emergency service, who has to stay in touch with the caller and the ambulance crew, can use Martin's personal ID code to query the health information system for his medical records. The system will automatically fill in a form and provide the medical data about Martin to the ambulance car that is rushing to the scene. Martin has hemophilia, which means that his blood does not clot. This information allows for the right decisions to be made quickly on the spot. On their way to the hospital, the ambulance crew assesses Martin's condition and forwards this to the health information system through which the doctors can automatically access Martin's medical records, including the results of his most recent tests and e-consultations with the family physician and medical specialists. This allows the hospital to make any preparations necessary and quickly come to the aid of the patient. All ends well thanks to fast information exchange, and Martin is sent home to recover. It's been a few weeks since Hugo broke his arm. His family physician removes the cast and discovers a strange rash underneath. She consults a dermatologist using e-consultation. It's an efficient way for a family physician to consult with a specialist and save everyone's time. The dermatologist, who can also access the medical records about Hugo, gives recommendations for further treatment. This provides the best possible care, and Hugo is glad he's well again. Lee receives an email notification through the state portal that her driver's license is about to expire. To renew her license, Lee needs a medical certificate, which is issued after a medical checkup. Before going to the doctor, Lee first opens the patient portal to fill out a health declaration. After she signs it digitally, the declaration can be accessed by the doctor. It gives her the information about Lee's health in advance. The pre-filled declaration makes the visit quicker. The health certificate is immediately sent to the National Road Administration, and all Lee has to do is apply for license renewal using the information system of the Road Administration. This will only take a few minutes, and in a few days, she will receive her new license by mail.
Right. So that's a bit of an overview of how the system works. And I'd like to use my final minutes to talk to you about some of the things that we've learned across this journey. So we started digitizing healthcare 10 years ago. We started digitizing the state 20 years ago, so there's been quite some lessons learned. Number one, which is very important for digital health, is that you have to find a balance between the digital factor and the health factor, and that if you are digitizing the service, you have to make sure that it's not just good for the administrator, it's also good for the patient, and it's also good for the doctor. So here's two very different graphs. The top graph is e-prescription. E-prescription took us to go from 0 to 80% electronic prescribing in 9 months' time. So it was very quick uptake, and it's because it got the balance right. Not only are you getting a better service as a patient, not having to go to a doctor to get a prescription every time, you're also getting a better service as an administrator. You get good electronic data about prescriptions, but also as a doctor, you save so much time because renewing a prescription takes you 10 seconds, for example, or you can create a decision support which gives you information about drug interactions at the point of prescription. So it was a no-brainer to adopt this. Whereas the bottom graph is the adoption of the National Electronic Health Record, which took us about 6 years to really gain some kind of momentum, and the reason being that the balance was not right at the beginning. You have to work on it. And that brings me to the second point, which is iteration. Nowhere in software design do we just ask you once what you want, and then we go away for 6 months and come back with a ready-made product. You have to iterate. You have to come back to the patient, have to come back to the doctor asking, is this what you wanted? And then make changes. Sadly, this wasn't always how we used to create technology for doctors, and this has caused problems down the road. But moving forward, everything is done in an iterative process. Then it's a multi-stakeholder process. Healthcare digitization is much bigger than just your digital department and the Ministry of Social Affairs. You actually need to get people from the entire health spectrum, not just the public health people, but also the patients, the doctors, the companies, everyone in the room, to discuss what is actually important. And I think one key lesson learned here is that you shouldn't have a separate e-health strategy. You should have a health strategy, and e-health should be integrated as a part of that, so that everyone knows that this is actually contributing to all of our goals. But a multi-stakeholder process also needs leadership. And this leadership doesn't just come from the Ministry of Social Affairs or Health, for example. This can also come from the head of government, because digitization, many of the building blocks are the same regardless if you're digitizing health or if you're digitizing the entire state. We say that Estonia has 2 e-services, digital identification and data exchange. Everything else is based on that. So if you are working to digitize your healthcare system, work with the people digitizing the entire government, because it's often the same building blocks, and make sure that you have very clear roles. You know who is responsible, not that you divide this responsibility between ministries, between the payers, between the hospitals, because that will only lead to fragmentation in the end. And it's very key to take an ecosystem approach to this. And by ecosystem approaches mean that you work with the companies in your country, because there is so much innovation on the market. There are so many people interested in making health better through digital affairs that you as a government official have to work with them. Most Estonian e-services were not built by the government. We just built the framework, and then we allowed companies to provide the services within that framework, ensuring that you have security principles, that you have interoperability principles. And I think this has led to a lot of important flexibility. And finally, something that I recommend you think about now is, how are you going to start using all of this data? You have to think about secondary use. That means thinking about how you structure the data, how you create connections between data points, how you measure outcomes, because this is actually a very valuable resource that you're gathering, prescription data, healthcare data. This can be used for research, and there's a lot of interest, not just in academia, but also in the private sector, to access de-identified data about healthcare and create new kinds of services like the Apple Watch, for example, which is able to measure your ECG and also detect arrhythmias. This comes from data, and you are creating this data. So you also think about how this data can be used for more than just clinical work. And I will conclude there. Thank you very much.